Today we are going to discuss about eclampsia in pregnancy. Eclampsia in pregnancy is a multi-system disorder which is an extreme form of preeclampsia. Preeclampsia complicated by generalized tonic-clonic seizures or say coma leads to eclampsia. So what really happens in eclampsia? So in eclampsia, there is a lot of organs that are affected. So usually the patient presents with generalized tonic-clonic seizures to our labor wards. And when you measure the blood pressure, it's usually high, say around more than 140/90 is the baseline blood pressure from where we can calculate that the woman is having eclampsia. Also, we have to rule out other conditions that may lead to generalized tonic-clonic seizures. For example, electrolyte imbalance, infections like meningitis, encephalitis. So we have to very careful to rule out these conditions to arrive at a diagnosis that a woman is having eclampsia. And let me say, eclampsia is a very severe form of severe preeclampsia, and we have to closely monitor the woman, keep her admitted, and do all the investigations and the generalized workup so that we can save a life. The maternal mortality in eclampsia is quite high. In westernized countries, though they have a very strict monitoring system, they have good ICU supports, ventilatory supports, the midwifery system is very good, the nursing care is extremely good. For that, the incidence has quite a bit reduced, 1 in 1000. However, developing countries like India are still behind the figures. We have 1 in 5 maternal deaths are due to eclampsia, mostly in rural areas where women are not aware that they have a high blood pressure and they don't do their investigations in a proper method. So the questions usually asked regarding eclampsia in pregnancy are, which are the most common symptoms? Usually the woman presents with a very headache, like a very typical frontal or say around a occipital headache. It's very characteristics of eclampsia, and the headache is due to the cerebral anoxia. So in eclamptic women, the vessels are really very much constricted, so the blood supply to the target organ, say around the brain or the liver or the kidneys, are really hampered. So the woman has a very a feature of headache. She presents to the labor room with a headache and a high blood pressure. The second can be due to epigastric pain. She usually tells that I have a strange pain in my belly near the epigastric area, and it is due to the stretching or the pulling of the liver capsule. So whenever a question is asked like why is the epigastric pain occurring in eclamptic women, it's mostly due to the stretching of the epigastric of the liver capsule. And this leads to also the derangement of liver enzymes that we see in eclamptic women. So usually what happens, all the liver enzymes are deranged. So when you do an LFT or a liver function test, you will see that these enzymes are totally altered, and you have to put a close watch on these enzymes when you admit a patient with eclampsia. So the third thing, what she presents is a lot of visual symptoms, like she'll present with scotoma and she'll present with blurring of vision, and she'll tell that well, I can see like lights flickering in front of my faces. And the third thing can be a reversible blindness. Reversible blindness because once you deliver the baby and take out the placenta, the blindness is gone, and it's due to her edema in her occipital lobe and cerebral anoxia. So the questions usually revolve around this type of things, like why a woman has blindness, what are the presenting symptoms of eclampsia, and how you are going to look for a woman who really presents to labor ward like you think that she is having eclampsia. And eclampsia can be of 3 types, like antepartum eclampsia, eclampsia which occurs in a woman who is pregnant, and the second form is postpartum eclampsia, It occurs in women who are who have delivered a baby, and around day 2 is the typical presentation of postpartum eclampsia. And antepartum eclampsia, that is a kind of eclampsia occurring in pregnancy, is the worst kind of eclampsia. This is also an MCQ, like out of all kind of eclampsias, which is the worst eclampsia? It is antepartum eclampsia. And the reason why, because antepartum eclampsia means you already have a baby inside your inside your belly, you are pregnant. So there are a lot of things can affect the baby as well as the mother. Whereas in postpartum eclampsia, you don't have a baby and don't have a placenta. So of course the mother is going to be affected. And antepartum eclampsia can really lead to intrauterine deaths, like dying of babies inside the uterus. So it's a kind of a dangerous kind of eclampsia. And when you see a woman with eclampsia, there is no other thought. You have to keep her admitted. So you have to keep her admitted, and you have to start magnesium sulfate. And this is the mostly asked question, like which is the drug of choice for eclampsia, is the magnesium sulfate. So there is a loading dose of magnesium sulfate and is a maintenance dose of magnesium sulfate. So another question which might be asked, why magnesium sulfate you choose for eclampsia? Because it has a neuronal stabilizer action. So it really stabilizes our excitatory neurons that are quite seen in eclamptic women. So you prevent those seizures and treat those seizures. And other anticonvulsants, say like lorazepam and levetiracetam, you usually never give. A woman with eclampsia presenting with labor room with seizures, start her on magnesium sulfate. The second question which I usually think that examiners are going to ask is, the most important thing you monitor in labor wards when you admit a preeclamptic or a eclamptic woman is the urine output, because the kidneys are usually affected in eclamptic women. So there is a decreased renal perfusion, the blood going to the kidneys are hampered, the kidney vessels are much constricted, so there is decreased in urination. So whenever eclamptic woman has decreased urine output, that is 25 ml to 30 ml output per hour, it's going below that, you have to keep a strict eye. You have to see whether she's drinking enough fluids, getting adequate hydration, and still not urinating. Send her kidney function test, like see her kidney enzymes, see her urea, see her creatinine, see her electrolytes like sodium, potassium, how is she doing. These are very important things and very much asked questions in exams. And also, what other things you have to see apart from the vitals like the blood pressure, the heart rate, you have to see the knee jerks, like the bilateral knee jerk. So always, like in labor wards, you will see the postgraduates will be carrying with a knee hammer and doing a knee test or seeing the knee jerk whether it's functioning or not, because giving magnesium sulfate will really, at times it leads to magnesium toxicity. So in order to prevent that, in order to see that whether the woman is landing up into magnesium toxicity or not, we closely see the knee jerks in labor wards. Thank you.